COVID cases are on the rise, but deaths remain low.
News 10 NBC's Erica Acosta has been speaking to doctors all day about how you can stay healthy.
The flu isn't a concern right now in Monroe County. It's too soon to even start talking about it, but COVID cases are actually on the rise, even more so than compared to last year at this time. Doctors say it's not uncommon for illness to spike right after Labor Day. Hospitalizations are up in Monroe County. Right now, about 150 to 160 people are hospitalized for COVID. But deaths are down and severity on the general public is low. Dr. Marielena Velez de Brown, acting commissioner of public health for Monroe County, says there's a lot of community immunity with COVID. Because of that, she's hoping for a milder season.
We expect the numbers to go up as we go from early fall into winter, kind of reach its peak anywhere between December, January, and then start to come down in March. That's the typical shape of our upper respiratory infection curves. And so we would hope that COVID would follow that same projection.
Dr. Ed Walsh heads URMC's infectious disease unit. He says if you haven't had COVID recently in the last 4 months or so, it's recommended you get the current COVID vaccine.
Because it does match quite nicely right now what's circulating. Last year's COVID vaccine is really outdated. What is clear is that this newer increase in cases is associated with these new variants, these variants that are known as the flirt variant. That simply has to do with the genetic changes that have been identified in the strain.
Now is a good time to take inventory of COVID tests in your home. The federal government will be making 4 free tests available per household this season, and you can order at the end of September. Reporting Erica Acosta, News 10 NBC.
Doctors also advise you to check to see if old COVID tests have expired.